Health and safety, the Youthtown way. New Zealand has a really poor history of workplace injury, illness and deaths. On average, 50 to 60 people were dying from work-related injury every year. 600 to 900 people were dying from work-related illnesses. And there were 9,300 serious harm injuries. New Zealand's at-work death rate was 2 times that of Australia and 3 times that of the United Kingdom. In 2010, there was a mine at Pike River. It was pretty unsafe. It was very gassy and did not have the right systems in place if an emergency did happen. Lots of people knew that it was unsafe, but changes were not made. On the 19th of November, there was an underground explosion in the mine. 29 men did not return home from work that day, and no one was held responsible. This was the trigger for change. So New Zealand got together and reviewed all of the health and safety laws. From this, the Health and Safety at Work Act 2015 was drawn up. The Act clearly states that everyone in the workplace has a responsibility for health and safety at work. Let's look at those responsibilities now. Person conducting a business or undertaking, the PCBU. That's Youthtown. The PCBU has the primary duty of care. Youthtown must ensure the health and safety of its workers, that's you, and ensure the health and safety of everyone else at Youthtown, that's our participants. Youthtown must make sure that the workplace is safe and without risk to your health and safety. Youthtown must ensure that there are acceptable facilities for you to use at work. Youthtown must teach and train you how to do your job safely, and Youthtown must monitor your health and the conditions in the workplace. Next is the officer, the CEO and the senior leadership team. The officers must exercise due diligence. This means that our CEO and SLT must have up-to-date knowledge of health and safety matters. They must have an understanding of operations at Youthtown. They must ensure that the board is receiving the right information, and they must ensure there are enough resources for us to do our jobs safely. And last but not least, the worker. That's you. You must take care of your own health and safety, and the health and safety of those around you. How do you do that? You comply with reasonable instruction given to you by your coordinator, team leader or manager, and you follow the policies and procedures you have been taught, and you report any incidents or hazards that you see using our health and safety management software, Risk Manager. Your coordinator or manager will teach you how to do this. So how does the Health and Safety at Work Act fit in at Youthtown? The Act guides the industry standards and codes of practice. From the standards and codes, we make our Youthtown health and safety policies. This includes our Health and Safety Guiding Principles Policy, HSO1, which is our overall commitment to health and safety at Youthtown. Please take some time to read this policy after the video. From those policies, we make our Safety Management System procedures. And from those, we make our Standard Operating Procedures and Activity Management Plans. And from there, we make our daily checklists and run sheets. All of this guidance helps us to reach our organisational goal of safe places, safe people, safe programs. All of this paperwork is reviewed on an annual cycle. We plan our programs, we deliver them, we evaluate them, and we make changes. Then we cycle back and do it all again because Youthtown is committed to continuous improvement. There are some key people at Youthtown who help with this cycle of continuous improvement. There is the Health and Safety Professional, the Regional Health and Safety Committees, and the National Health and Safety Committee. The committees meet regularly to address incidents, trends, and areas for improvement. They are always welcoming of your feedback. Their job is to manage hazards and risks in the workplace, and they won't know what to manage if we don't tell them. The committee's job is to be your voice on the health and safety matters to the board. But what are hazards and risks? Imagine there is a shark. Sharks are scary. Now imagine all the things a shark could do to you. shark bite, amputation, drowning, death. These are risks, the chance that something might hurt you and how bad that might be. The shark is the hazard, the thing that could hurt us. The Act says that we must manage risks through health and safety. We can do this in a few ways. We could remove all the sharks in the whole world. Although some people are trying, it doesn't seem like such a good idea. We could monitor where the sharks are and only swim where they are not. We could only swim in shark cages. We could wear a bright coloured wetsuit so that we don't look like food. Or we could put up signs on a beach saying, "Beware of the shark." These are controls, and they reduce the chance that the hazard might harm us and how bad that harm might be. Your team leader or coordinator will tell you all the specific risks and hazards that may affect your work. You can also find the site-specific hazard register on Risk Manager under Safety Plan. But what does this really mean for you? Our programs are designed so that on day one, you can turn up and do your job safely, worry-free. Over your career with Youthtown, we will teach you everything you need to know about doing your job safely. This might include standard operating procedures, pool supervision, driver safety, and risk management. As you go along in your career, you will learn more and more about health and safety management. Even though we have lots of planning and training, because we work with kids and youth, it's likely that something will go wrong. And what do you do when that happens? Firstly, you deal with it. Apply first aid, calm the participant, and get help. Report it to your coordinator and on Risk Manager. We will investigate the root cause, and then we will make any necessary changes. Your coordinator or manager will let you know of any other responsibilities you may have in regards to incident management. If an emergency happens, like a fire or an earthquake, follow the instructions of a senior staff member. Ensure your own safety, ensure the safety of any of the participants or guests on site, and then follow the evacuation procedures. We do an evacuation drill every term, so you can learn all about it. In the meantime, at every site we have an emergency procedure flip chart. Please take some time to look at this over your first couple of days. If you suffer any harm at work, please tell us. We want to help you get back to work as soon as possible. We have a health and safety handbook included in your induction pack and a copy available at each site. If you want to read more information about any of the topics covered in this video, the handbook is where you will find it. You have now completed Health and Safety the Youthtown way. Time to see how much you've learned. Please click the link below to complete your short quiz, then return to the Prezi to complete your induction. Thank you for watching Health and Safety the Youthtown way.